Very good morning, dear students. Chapter 2, Congestive Cardiac Failure. Today we are going to discuss about cardiac glycosides. Now, regarding history of cardiac glycosides are obtained from the plant of the foxglove. This is very important. So, this plant were known to Egyptians 3000 years ago. They were irrationally used. William Withering, an English physician, first described the clinical effect of digitalis in congestive cardiac failure, 1785. Regarding chemistry of congestive cardiac glycoside, these cardiac glycosides are the combination of an aglycone or genin and one of four sugars. The aglycone is chemically similar to bile acid and to steroids such as adrenocortical and sex hormones. It is the pharmacologically active portion of the glycosides. Second one is the sugar modify the water and lipid solubility of the glycoside molecule and thus affect its potency and duration of action. Glycosides are combined with dried leaves of the foxglove, it is Digitalis purpura, Digitoxin, or Digitalis lenta, that is Digitoxin or Digoxin, and from the seeds of the Strophanthus gratus, that is Arvind. The term digitalis is frequently used to refer to the entire group of the cardiac glycosides. Regarding pharmacokinetics, let us discuss first about digoxin. The bioavailability varies. Intestinal absorption of the drug may be as low as 40%. Serum half-life is normally about 36 hours. Digoxin is not metabolized and is eliminated principally by the kidney in almost unchanged form. Regarding pharmacokinetics of digitoxin, digitoxin is well absorbed, approximately 90 to 100% from the gastrointestinal tract, and does not have the variable bioavailability seen with digoxin. The serum half-life of digitoxin is about 5 to 7 days. Digitoxin is metabolized by the liver, and the drugs that increases the activity of hepatic microsomal enzymes such as phenobarbital and phenytoin accelerate its metabolism. In contrast to digoxin, digitoxin is approximately 97% bound to plasma albumin. Now, pharmacological effect of cardiac glycosides. Let us discuss about the general consideration. The most important property of the cardiac glycoside is their positive inotropic effect. That is, their ability to increase the force of myocardial contraction. The result is increase in cardiac work at reduced metabolic cost. Cardiac glycosides also have effect on the electrophysiological properties of the heart, that is conductivity, refractory period, and automaticity. In addition to this, glycosides have extra cardiac effect on vascular smooth muscles, neural tissues, and other tissues. Now, the effect of cardiac glycosides on heart. Number one, myocardial contractility. Cardiac glycoside increases the contractility of cardiac muscle by increasing both the velocity of the muscle contraction and the maximum force that is developed. Cardiac glycoside appears to exert their positive inotropic effect by following mechanism. Number one, digitalis inhibit membrane-bound sodium-potassium activated adenosine triphosphate, that is sodium potassium ATPase, and thus it increases intracellular calcium level. In congestive heart failure patient, glycoside increase cardiac output, decrease cardiac filling pressure, decrease heart size, and decrease venous and capillary pressure, which is reflected by a downward shift in the ventricular curve. Let us discuss about the myocardial oxygen consumption. The digitalis induced increase in myocardial contractility causes an increase in myocardial oxygen consumption. Second one, decreased ventricular volume resulting from the digitalis induced increase in muscle tone and cardiac output that leads to decreases the myocardial oxygen consumption. Electrophysiological activity, cardiac glycosides indirectly increase the vagal tone of the heart. The prolonged and refractory period of arterioventricular AV node and decrease conduction velocity both directly and indirectly through AV node. Heart rate. In normal individual, digitalis has little effect on the heart rate. In congestive heart failure patient, digitalis slows the heart rate, a negative chronotropic effect. This results from the vagal nerve stimulation, which slows pacemaker activity at the sinoauricular or sinoatrial node. Excessive dose of digitalis can produce tachycardia. Now, extracardiac effects. When cardiac glycoside increase the cardiac output in congestive heart failure patient, there is a drop in the peripheral vascular resistance and venomotor tone as well as increase in the blood flow. In normal individual, digitalis produces venous and arterial constriction. A diuretic effect occurs because the increased cardiac output and renal blood flow combine to reduce the neurohumoral factor that inhibit the excretion of salt and water. CNS high dose stimulate citizen resulting in nausea and vomiting. Therapeutic uses of cardiac glycosides. These cardiac glycosides are of greatest value for treating low output cardiac failure. They also they are also of great value in control of atrial fibrillation and flutter as we seen in the last slide. Paroxysmal atrial tachycardia frequently respond to digitalis therapy presumably as a result of reflex vagal stimulation. Contraindication of cardiac glycosides. The use of the cardiac glycoside is contraindicated in cardiac tamponade, high output congestive heart failure, constrictive pericarditis, idiopathic hypertrophic subaortal stenosis with outlet obstruction, patient of MI, hypokalemia, and thyrotoxicosis and myxedema. Digitalization and maintenance of doses. Digitoxin. When there is no urgency, an oral digitalized drug dose is first administered and then the maintenance dose is adjusted. So the basis of clinical and laboratory assessment, usually a steady state level is achieved in five half-lives, about 8 days. When digitalization must be achieved rapidly, digoxin can be administered intravenously over a period of several minutes. The onset of action is within 5 to 30 minutes. The maximal effect is reached within 1 to 5 hours. Digitoxin. Digitoxin. The total oral loading digitalizing dose of digitoxin is divided into doses given every 6 hours and administered over the course of 36 to 48 hours. The maximal effect of the dose of digitoxin is reached approximately 7 hours after oral administration. Once optimal benefit has been achieved, maintenance dose usually is adjusted to 10% of the digitalizing dose. Adverse effect. Digitalis glycosides have a low margin of safety, and intoxication from an excess of the drug is a common and potentially fatal problem that is called digitalis toxicity. Intoxication is most frequently precipitated by the depletion of serum potassium caused by diuretic therapy, but it can also occur from accumulation of maintenance glycoside doses taken over a long period of time. Intoxication from hypokalemia may also occur as a result of prolonged administration of corticosteroid, uh, protracted vomiting, and protracted diarrhea. When the concentration of digoxin and digitoxin rises above 2 nanogram per ml and 25 nanogram per ml of blood respectively, signs of systemic toxicity often appears and therapy must be discontinued. Sign of toxicity includes anorexia, nausea, vomiting, diarrhea, headache, fatigue, malaise, neuralgias, and delirium. Vision changes including abnormal color perception, gynecomastia, which is a rare condition, and cardiac effects. Premature ventricular contraction, PVCs, and ventricular tachycardia and fibrillation. AV dissociation and block, sinus arrhythmia, and SA block. Treatment of digitalis toxicity. Cardiac glycosides and potassium depleting diuretics are discontinued. Potassium chloride is administered orally or by slow, careful intravenous infusion of hypokalemia is present. Potassium is not given, however, if there is severe AV block or if serum potassium levels are high. Because hypomagnesemia may accompany hypokalemia, magnesium replacement may also be necessary. Phenytoin can be given for ventricular and atrial arrhythmias. Lidocaine and procainamide can be used to treat ventricular tachyarrhythmias. Propranolol can be used for ventricular and supraventricular tachycardia but not in the presence of AV block. Atropine can be used to control sinus bradycardia and various degrees of AV block. Cholestyramine bind to cardiac glycoside and has been used to hasten their elimination. A digoxin specific antibody fragment from the immunized sheep is available for the treatment of life threatening digoxin and digitoxin overdoses. Its use is reversed by patients exhibiting shock or cardiac arrest, ventricular arrhythmia, progressive bradyarrhythmia, or severe hypokalemia. In the next session, we'll discuss about other positive inotropic drugs. Today, we stop the session over here. Thank you very much.